Open or closed? That is the question. When we talk about whether a medicine works or it doesn't work or it hurts you, having access to information or not can be a question of life or death. Do we have that access today? Here with us, we have the member of the European Parliament, Margrethe Auken, who has worked on the regulation of access to clinical data that was in place. Ms. Auken, do you think that we have enough openness and transparency today?
Well, in principle, yes, but in reality, no. I think that we are still stumbling into all these obstacles that industry, of course, put on us, but they, of course, they cannot do it directly, so they have their civil servants, our civil servants, or authorities to follow what they want to keep secret.
They have so much control over our regulators and civil servants?
Yeah, well, I could put it different, saying that we have too little transparency to what our authorities are doing. So if we could follow who they meet and who they have...
You're talking about lobbies?
Yes.
Oh.
And we should be much more clear on having good lobby registers. We should know the lobbies when they're coming here, everywhere. Who are they? Who pay them? And what is their purpose to be there?
And Mr. Peter Goche, why is it important for us to have access to this information on the efficacy and the dangers of pharmaceutical? What happens when we don't have access to this data on safety and efficacy of drugs?
What is the case right now is that our drugs are the third leading cause of death after heart disease and cancer. It's a lethal epidemic that we use far too many drugs, and many of those who died didn't even need the drugs that killed them. This is the effect of not having access to all the data.
These are very, very strong, impressive words. But going down deeper, I'm going to ask this question in Spanish. El modelo de innovación médica que controla sobre todo unas grandes empresas, ¿cómo podríamos cambiar este modelo farmacéutico para que sirviera mejor la apertura, la transparencia y sobre todo el acceso y el bienestar de la gente?
Bueno, efectivamente, el control está en manos de las grandes compañías farmacéuticas. Hay que quitar ese control y eso se haría quitando la relación que hay para pagar los medicamentos de la financiación de la innovación. Nosotros pagamos con los precios de los medicamentos, nosotros, los ciudadanos y los servicios de salud, pagamos a las compañías farmacéuticas un sobreprecio porque hay un monopolio que les damos los gobiernos. Esto se tiene que cambiar para que ese monopolio no siga permitiendo hacer ese control.
Pero estás hablando de patentes.
Estoy hablando de que los gobiernos dan patentes a las compañías farmacéuticas y eso es un monopolio para que vendan el medicamento sin competencia durante 20 años. De esa manera pueden subir un precio, poner el precio que quieran y pagamos precios abusivos, precios excesivos. 1000 veces más del coste de producción y de investigación. Con ese dinero podemos hacer lobby. Con ese dinero estamos pagando a las empresas farmacéuticas 100.000 millones de euros al año para que hagan investigación. Pero solo se gastan 27.000 millones de euros. El resto, 70.000 millones de euros, va para hacer lobby, para hacer propaganda, para hacer una presión sobre el médico para que recete ese medicamento que puede hacer daño. Hay muchos medicamentos que hacen daño y para que otras personas no puedan acceder al medicamento que necesitan. Por tanto, ese es el principal objetivo. Y mientras tanto, insistir en aumentar la competencia. Se puede cambiar la ley en el Parlamento Europeo para luchar contra la política anticompetitiva de las empresas.
Hacer más medicamentos genéricos.
Hacer más medicamentos genéricos, permitir las licencias obligatorias, quitando la exclusividad de mercado y la exclusividad de comercialización y, desde luego, insistiendo en la apertura de la información, open access, la ciencia abierta.
This is very interesting because Fernando says because they charge these abusive prices based on the patent monopoly, they're able to pay armies of lobbyists who are here behind us visiting all the MEPs. And are there lobbyists visiting MEPs in this building?
Yeah, well, they haven't given up on me. So, well, as far as I can see. Now, I think one of the real heavy problems is that we have not got rid of conflict of interest in by the authorities. You know, if they are absolutely clean, it's much easier. But it's still accepted, you know, that they have, you know, if they make a declaration of conflict of interest, everything is okay, and it's not.
That's right.
And that, I think we have to be much more strict there. Yes, clear lobby register, lots of transparency, but it's not enough.
Transparency is not enough.
Yeah.
Do you agree with that?
Yeah.
Do you think these conflicts of interest should be prohibited? Do you
Yeah.
think that the pharmaceutical industry should be able to visit all of the doctors and all the politicians and
No,
all
but
that?
that's a difference, David.
No?
Be careful.
And just declaring it as not?
Politicians always have interests.
Yeah.
So it's those who make decisions on behalf of us who should have no conflict of interest. If we mix it, everything is confused. But we should be transparent. We should be transparent, but those who prescribe medicine or decide how a law is implemented, how it's used, they should have no conflict of interest, and that's a problem in EMA. That's a problem.
The European Medicines Agency.
Yes. And I think this problem is all over. You know, Denmark tries to say, "Oh, we are so fantastic, no corruption." So, yeah.
Anyway, Anna Pérez, you represent an organization called Universities Allied for Essential Medicines.
Yes.
How are young advocates for access to medicine at universities or young medical students, how are you working for a better future in the medical field?
That's a great question. So with my NGO that I represent, so we believe that universities are a really powerful stakeholder within the access to medicines movements, and therefore we believe in empowering students across the world. We have many students working at campuses across the world to work with universities to make sure that there is increased transparency when it comes to their clinical trial results, or making sure that they implement socially responsible licensings which increase access to medicines and includes promoting generic competitions with the drugs that they produce at their universities. So we really believe in empowering students around the world to fight at their campuses where there's a lot of activity going on and where universities are a very powerful stakeholder to then close this gap that we have within the access to medicines movements.
But are universities today and medical schools, are they working for the common good, or are there lots of their education and their research being sucked up by private interests?
It's a tricky question. I would believe in principle. So, as you said earlier, in principle, they'd probably like to say that they aren't, but behind closed doors, it's quite a lot of partnerships going on and quite a lot of blurred lines when it comes to transparency and when it comes to conflict of interest with universities.
Okay, a last question to all of you. I would like you to say in 10 words, one sentence, what you think you could imagine as the best future for medicine and medicine innovation. Fernando.
La innovación independiente financiada sin participación de las empresas farmacéuticas.
Excellent. Peter.
With access to all the data and involvement of patients so that we can study patient-relevant outcomes.
Interesting. Megreide.
Yeah, I would say no conflict of interest, full transparency, and an absolutely free debate would be the best help we can have. So you cannot impose silence on anybody. That would help a lot.
Academic freedom.
Yeah.
Anna?
I would go for the patient level and say a world where patients can get access to medicines which they know are effective.
Excellent. I'm David Hammerstein. I represent the Commons Network, and to close this, my sentence would be healthcare and medicines and medical research is a common good. It should not be enclosed. It should not be hidden. It should be for all of humanity. Thank you very much.